and welcome to CBC News. I'm Bradley Fang.
I'm Vicky Lim.
Thank you for joining us. First up today, quarantine plan ready in case of bird flu outbreak. The first cases of the H7N9 virus were reported in February in eastern China. According to the WHO, there is no evidence that the H7N9 virus is being transmitted between people, and most cases come from poultry. International health experts have commended China on its transparency in reporting the spread of the virus, in sharp contrast to its handling of a SARS outbreak in 2003, when 8,096 people were infected worldwide and 477 died.
The death toll of the latest bird flu outbreak in China is now at 35, and there were 4 suspected cases in Taiwan, and only 1 was infected with confirmation. Thus, far the H7N9 disease has not had a major impact on Taiwan, but if it does spread, the Department of Health says it has a comprehensive quarantine plan ready.
This is the negative pressure quarantine room at Taipei's Heping Hospital. There are 22 hospitals with facilities like this around Taiwan to deal with an epidemic.
When the diagnosis is confirmed, the patient is sent to our hospital. Of course, it is possible that the beds could be filled. If we can handle all the patients, we send the overflow to hospital with second-line quarantine facilities.
If the epidemic became even larger, the Department of Health may follow the protocol it used at Heping Hospital during the SARS crisis. It could clear all regular patients from public hospitals and only admit those suffering from H7N9. Other steps during an epidemic include sending travelers at Taoyuan Airport suspects of having H7N9 directly to Taoyuan General Hospital for screening. People who do not display symptoms until later will go to a local hospital. The Council of Agriculture, meanwhile, says it has sent a group of China to collect samples of infected birds.
The team departed last week. We sent it to the location of the outbreak. China has pledged to give Taiwan samples of the virus upon request.
The second news, Taipei City set up ban on pigeon feeding due to H7N9. In light of the growing H7N9 epidemic, Taipei City Department of Environmental Protection is enforcing a ban on the feeding of pigeon and wild birds. Beginning this month, inspectors visit tourist locations such as Liberty Square, where they began issuing fines. Upon visiting Liberty Square's exciting Chinese tourists produced bags of the biscuit to feed pigeons. It seemed that these people had forgotten the stern warning by the tour guide not to feed these pigeons. This led a number of inspectors to step forward and stop them.
The warning may be wasted on not only Chinese tourism, but also the few Taiwanese people, as one grandmother threw bread from her car window. This led Taipei City Environmental Protection Bureau to issue her a ticket.
This is in accordance with provisions Article 27 of the Waste Disposal Act. Any feeding of wild pigeons will cause environmental pollution.
H7N9 concerns have led to renewed vigilance regarding a ban on feeding pigeons and other wild birds at 13 popular tourist destinations in Taipei, including Freedom Square and 228 Peace Park. Enforcement of this ban has been strengthened with a possible fine between 1,200 to 6,000 NT dollars.
The last news, port monitoring. The outbreak of H7N9 virus has led Taiwan Centers for Disease Control to expand Tamiflu use and implement stringent new immigration checks. Taoyuan International Airport custom officers are keeping a close look on these monitors to see if any new arrivals have a fever. Any overhead electronic signboard also displays the news of deaths related to H7N9 bird flu in China. Starting from April, the CDC stepped up its immigration monitoring.
We will closely monitor our medical institution. We have enough Tamiflu to cover more than 50% of population according to our national influenza pandemic preparedness plan. We extend Tamiflu used to include those with flu-like symptoms who have had a fever for more than 48 hours.
In the past, H7N9 has been confined to birds, with no reported cases of human transmission. However, in early March, 2 million Chinese came down with a fatal cases of this disease. The fact that Chinese authorities waited until the end of March to make this announcement leads many to fear that the virus has begun to spread.
You could say that in Asia or the world, 99% of people have not been exposed to this virus. But if they mutate into a variant that can be transmitted quickly from human to humans, it could become a worldwide pandemic.
At international ports, travelers from areas with known cases of H7 and 9 bird flu face more extensive checks. These areas include the Chinese province and cities of Jiangsu, Anhui, Shanghai, Nanjing, and Zhejiang. Anyone entering Taiwan from China who has had close contact with birds over the past 7 days and is exhibiting flu-like symptoms could end up quarantined for further observation.
While the CDC is scrambling to learn more about the outbreak, in the meantime, it is encouraging people to wash their hands frequently and avoid contact with birds.
This is CBC News. Thank you for listening.
Thank you for your performance.